Hi everybody, it's Dr. Baron here at Breast Body Beauty Plastic Surgery. So today I'm going to talk to you a little bit about drains. A patient may potentially need a drain after a surgical procedure if for some reason they've had a procedure like a tummy tuck, a breast reduction, or sometimes even liposuction. Why would a patient need a drain though? Patients may need drains because during these types of procedures or surgeries, there are many lymphatic channels and blood vessels that are cut. And even though a lot of times they're sealed off or we stop the bleeding, you may leak fluid into the surgical cavity, or I call it kind of body juice, okay? That fluid may leak into the surgical cavity postoperatively, and as the body is trying to heal itself, it's not able to absorb that fluid. So that's why drains were created. Drains were created to evacuate some of that fluid from the surgical cavity so that you don't have a buildup of fluid excess, which can result in a seroma, which is a fluid collection, which could potentially lead to an infection, or that fluid trying to find its way out itself, which can then lead to a wound opening or a wound dehiscence is what we call it, okay? So drains were created in order to decrease the chance or eliminate the possibility of those potential postoperative complications happening. And so what will happen is a drain is placed in the body, and then it will evacuate that fluid, and once that fluid is ready to be absorbed by your body, the drain output will gradually go down, all right? So this is an example of a drain. They come in varying shapes, sizes, and types. This is a fluted drain, and normally this white portion right here will be the part that's in your body, okay? And so it has little channels in the end so that it will collect fluid, okay? Normally this portion will be the part that sticks out of your body and is sutured in or secured to your skin by a suture or a stitch, okay? Then you have the rest of this tubing, which can vary in length depending on how long your doctor cuts it. That will connect to a drain bulb or grenade, as we like to call it, because it looks like a little grenade. And don't worry, this is just cranberry juice, all right? And so this tube will collect to this grenade and collect fluid gradually over time, all right? So this is a closed suction drain and normally works by closed suction, meaning that you have to compress and get all the fluid out of the drain before it will actually suction. So if it's working correctly, then the drain will hold suction and be compressed, okay? Once the drain continues to get full, then it will start to inflate with fluid or fill with fluid. And so you know it's time to empty it. I normally tell my patients to empty their drain about twice a day, and then if it fills up in between. So once in the morning, once in the evening, and then anytime in the afternoon if it fills up, because then your drain will function more efficiently, okay? So I'll show you how to empty a drain. Normally, right before we empty a drain, what we'll do is have you do something called stripping a drain, okay? And so I'm gonna lose my suction right now. See that we've lost our suction on our drain, so that I can demonstrate stripping the drain. And a lot of times it's easiest to do this with an alcohol swab, or sometimes you can put some Vaseline or antibiotic ointment on your fingers so that your fingers slide over the tubing easily. And so basically what you're gonna do is with one hand, you or your caregiver is going to kind of secure the drain where it comes out from the skin. And then you're with the alcohol swab or your greased up fingers, we're going to slide this alcohol swab down the length of the tubing. And so you do that to push any clots that are potentially within the tubing down the drain so that the drain does not get clogged, okay? And so you do that all the way down to where the tube meets the grenade, okay? And so I normally recommend stripping the drain once or twice before you empty it, because then you can push all that stuff into the drain bulb and then empty it out, okay? And then what you'll have, which you will either get from the hospital or your doctor's office, is a little cup in order to measure the drain output. The drain output is normally measured in milliliters or cc's, which are basically the same unit. Don't try to measure them in ounces or drain, you know, there's some unit here that's a drain DR or some sort of drain unit, or teaspoons, okay? It's easiest for your doctor to measure and kind of figure out if your drain's ready to come out by doing either milliliters or cc's, okay? And you see here on this drain cup that it has milliliters right here, okay? So what we're going to do in order to empty the drain is you're going to take the stopper off, okay? You'll take the stopper off, and then with your drain cup, of course you'll have gloves on for this portion of the procedure, and we'll empty it into the drain cup, okay? And then what you'll do is you'll then recap your drain, okay? If your drain is functioning well, then you know that it's compressed, okay? It always needs to be compressed in order to function. If your drain is completely inflated like this, then it's not suctioning, and it's not going to function well, and you may end up with some fluid backup into your surgical cavity. So if your drain is not holding suction, then you need to call your doctor's office in order to make sure that we may need to troubleshoot, or you may need to come in and see what's happening with the drain, okay? So what you'll do is you'll then look on your cup, and you see this one's measured to about 40 milliliters. So if you have a drain sheet that's been given to you by the hospital or your doctor's office, you'll simply record 40 milliliters, okay? And normally when the drain is ready to come out, when you have about less than 25 to 30 cc's in this cup for 2 total 24-hour periods, okay? So 2 24-hour periods added up less than 25 cc's. So if today's Wednesday, so if Monday you had you emptied the drain and it was 10 cc's in the morning and then 10 cc's in the afternoon, then that's 20 cc's for that total day. And then the next morning when you measure it, it is 10 cc's and 5 cc's. Then that's 15, or 10 cc's in the morning and then 5 cc's in the afternoon, that's 15 cc's, okay? So it's 15 for that total day. So when you come in on Wednesday or call the office on Wednesday morning, if those are the same reads, then your drain is probably eligible for removal, okay? So I hope that kind of simplifies and gives you an idea of how to potentially care for drains for either you or one of your loved ones. If you have any questions or concerns, definitely call your doctor's office and speak with either the doctor or the medical assistant to get some guidance. A few things that you should not do when you are having issues with the drain are if the stitch comes out and the drain has started to come out, do not push it back in, just because that can potentially introduce infection or bacteria into the surgical cavity. So we want to do our best to minimize that, okay? Sometimes if the drain is not holding suction, sometimes putting a little bit of antibiotic ointment over the area where the drain comes out from the skin will sometimes help to decrease any small little bits of air or space that might be getting in there and preventing the drain from adequately holding suction, okay? In addition to that, sometimes the drain site where it comes out of the skin can be irritated sometimes, just because you should really secure your drain to either clothing or to a drain belt with like a bobby with a safety pin. And so if the drain is just left to dangle and move all around and hang on the floor, then that is going to weaken where the stitch holds it to the skin, and it can cause increased irritation for the person who has the drain, and it can cause the stitch to loosen prematurely, and your drain can come out prematurely, which can result in a seroma or fluid collection forming, and we definitely don't want that. So sometimes I'll tell patients to pad the area around the drain with some gauze, so like a 4x4, and then tape it down to your skin so that you decrease the amount of motion of the drain coming out of the skin, and so that will decrease pain or discomfort for the patient, and then it will just act as a belts and suspenders technique to keep the drain in place so that your suture does not loosen prematurely, okay? So I hope that clarifies things and gives you some idea on how to care for the drains. If there's any questions, always call your doctor's office to make sure that you're in compliance with their policies and procedures. Do not try to take drains out at home by yourself. Always do it under the guidance of a physician or medical practice, okay? So I hope that helps. Drains sometimes are a necessary evil, patients don't really like having them. I don't necessarily like putting them in, but certain procedures definitely call for them, or certain circumstances call for them to be used. Okay, so if you have any questions, you can comment below on this post. But any questions about your drain in particular, definitely call your doctor. All right, have a good day.